Hi Katie, I'm Rachel. I'm going to be your nurse tonight. I'm going to go ahead and put this blood pressure cuff on you because your heart rate was pretty high earlier.
Okay.
Can you tell me what brought you into the ER?
I've been feeling really tired lately, and I've been sweaty, and I feel like my heart's been pounding, and it's like about to come out of my chest.
And how long has this been happening?
For a few days now.
Okay.
And it's been hurting really bad right here. Like, oh, I just want to curl up into a ball and cry.
What would you rate your pain as at a 1 or 0 to 10 scale?
It would probably be an 8.
Sorry, babe. I'm here now.
Finally.
Alright, so I've been looking at my phone, and I have this app called WebMD, and it says it might be cancer, and I started freaking out.
Well, I'm sure that we'll do everything in our realm of things to do to make sure that we give her the best care. Katie, can you tell me more about your pain?
Well, I've been having it for about a week now, and it comes and goes, but it's really intense, and it lasts about 20 minutes, and then it lets up a little bit. And I've had a headache continuously for the past week, and Motrin doesn't even help. It's so annoying, and it's kind of like it's dull, but it can be really severe, too.
Okay.
Thank you.
Rachel notes that the patient has tremors, is pale, and is short of breath. The pulse ox now shows an O2 of 92% on room air. She's extremely diaphoretic.
She's been under a lot of stress at work lately, and I think it's made her sick. She has been taking decongestants and lost about 20 pounds over the last 4 months.
Okay. I'm going to put you on some oxygen because your O2 saturation is a little bit low. And I'm going to go get the doctor. I'll be right back.
Okay, thank you.
Hi, Dr. Cole. So I think you should come evaluate this patient. Her vital signs are elevated. Her blood pressure is running 150 over 100. Her heart rate is 120, sinus tachycardia, and her breathing is 20 breaths a minute, and she's on a pulse ox is 92%. I placed her on 2 liters of oxygen, and her temperature is slightly elevated at 38 degrees. She appears pale and diaphoretic. I noticed a slight tremors in her hand, and she has intermittent sharp abdominal pain she's been experiencing for over a week. She's complaining of continuous headache, and a friend is in the room and is very upset and worried about her. She does not have a history of hypertension and has not taken any medications except over-the-counter decongestants. I'd recommend getting an EKG and possibly a CT.
Okay, well, I'm playing Candy Crush right now, so I'll be in there when I get a chance.
Okay.
Hi, Katie. I'm Dr. Cole. Can you tell me when you began to feel this way?
It's been a little over a week now, but tonight it was so bad. I just had to come in.
Does anything make it feel worse or better?
Feels a little better early in the morning than it does as the day wears on. It seems I can't catch my breath. My heart is racing, and I was thinking it was the decongestants I've been taking, but I don't know now. It's just so bad.
Have you ever been told before that you have high blood pressure?
No, never. Do I have it now?
It is elevated and it might explain your headache. Have you ever been diagnosed with any other medical conditions?
No, I have no medical conditions. I'm healthy.
Okay.
Dr. Cole does a complete history and physical, and he determines that there is a family history of Pheochromocytoma.
I'm going to order some lab work, an EKG, and a CAT scan of your abdomen so that we can determine what might be causing your symptoms. A CAT scan is like a 3D picture of your abdomen. The EKG will show us information on how your heart is beating. Are you allergic to any medications?
Not that I know of.
Okay, I want to start an IV and give you some medicine for your abdominal pain.
Okay, sounds good. Can I have morphine?
I don't know.
Dr. Cole orders a metabolic workup and then an IV of normal saline to run at 100 milliliters an hour and morphine 2 milligrams IV. The doctor leaves the room. All right, Katie, I've got your morphine.
Okay. Can I have it now? Am I going to be okay?
We're going to do everything in our power to figure out what's wrong with you.
I don't want to die.
2 hours later, the EKG is complete and shows sinus tachycardia with the normal PQRST waves and no indication of heart problems. Lab work is back and everything is within normal limits. The CAT scan shows an adrenal tumor on the left side. The tumor is 6 centimeters. It shows that there is a mass, but the kind of tumor is unknown.
Katie, the EKG and lab work were all normal, but it looks like you have a tumor on your adrenal gland. We need to consult with a general surgeon. Do you have someone you would like us to call?
What? No, I don't even have a general surgeon. Why do I need a general surgeon when I have a tumor? Oh my banana peel, I barely have a dentist I see regularly.
A general surgeon specializes in growth abnormalities on endocrine organs, like your adrenal gland. I'm going to admit you to the hospital.
Okay.
A patient is one of those that doesn't seem capable of managing her health. I'm going to admit her and have a general surgeon take a look at her tomorrow, but we should do some more tests to find out what kind of tumor it is. Can you do a 24-hour urine sample?
Yes, for sure. Dr. Cole calls Dr. Dustin. Meanwhile, Katie is admitted to the hospital for observation to control her blood pressure and to monitor her abdominal pain. A 24-hour urine culture is ordered to check for catecholamines. Dr. Dustin arrives, and he enters the room and examines the patient. After reviewing the CAT scan and labs, he suspects that the patient has a pheochromocytoma because it runs in the patient's family, but needs the results from a 24-hour urine sample to confirm. The nurse, Alyssa, arrives for morning report on Katie and doesn't receive too much information other than her vitals are elevated and a 24 urine sample is started. She has morphine PRN. Alyssa checks the new orders and finds the general surgeon is adding some more medication.
Hi Katie, I'm Alyssa. I'm going to be your nurse today. I'm just going to go and check your blood pressure.
Okay.
Alright, your blood pressure is 154 over 102. Heart rate is 110. Katie, your blood pressure is still elevated. But Dr. Dustin has ordered some medicine I can give to you.
Okay, sounds good. Is there any pain meds?
I will check.
Okay. And also, Dr. Dustin came in here and he was saying so many big words that I just couldn't understand.
Yeah, doctors do that. I'll be right back with their medication.
Okay.
Alright, so I have prazosin here. It's an alpha antagonist, and this is a metoprolol, a beta blocker. And you will most likely be taking these 2 drugs when you go home, depending on what the doctor says, to help lower your blood pressure. You will take them twice a day. Side effects include dizziness, so you need to be careful when you get out of bed. When you might want to use your call light to let me know. I can go ahead and help you.
Okay.
When you get home, try not to drink any alcohol or take any over-the-counter medications, including your decongestants, or stop taking the drugs abruptly. If dizziness becomes a problem, you might need to increase your salt intake. Is there anything I can do for you?
I'm kind of scared, and I know the general surgeon was here, but I don't really understand why we have to wait to do the surgery, because I really want it now.
I understand. The doctor just wants to make sure he knows what kind of tumor it is. That's why we're collecting your urine.
Okay.
The next morning, Dr. Dustin checks the results of the urine sample and confirms it's pheochromocytoma and tells the patient his plan. He's going to discharge the patient once her BP is stable and have her come into his office to schedule laparoscopic surgery to remove it. Alyssa is back the next morning and has Katie assigned again. She reads over the doctor notes and goes to talk to Katie.
Good morning, Katie. I see that Dr. Dustin came in and talked to you this morning.
Yeah, he was. He was in here real quick, just like yesterday. And he said some even bigger words, like lapo, crazy, picotopia.
You mean laparoscopic surgery?
Yeah, that's probably what it is. I just want to go home right now.
It is a less invasive surgery where the surgeon makes small incisions into your abdomen and places a microscopic camera and other tools that allow him to operate inside your body without cutting you open completely. He also put in some discharge orders, and I will get you some more information on that and go over with you, and then hopefully get you out of here before noon. How does that sound?
That sounds fantastic. Thank you for explaining it.
Sure. Alright, Katie, I have your discharge papers. I have your medications here. We have metoprolol and prazosin, and I left some side effects here when I already went over the medications with you. I even have your follow-up appointment, which is in 6 days, and directions to that. And then I threw in some information on Pheochromocytoma for you.
Okay, thank
Alrighty?
you.
Any questions?
Not that I can think of. Babe, do you have any?
Nope, I'm good. Thank you so much for helping my girlfriend.
You're welcome. Alright, see you guys soon.
Alright, thank you.